Before we talk about IVF, which is something that's in the news and people are all interested about, what I really want to get across is every patient who walks through our door at Illume and should at any high quality REI center gets treated like a person, gets taken very seriously and looked at very thoroughly for a full and thorough fertility checkup. And we go through all of those things. Then I meet with the patients again and go through every single blood test, x-ray, ultrasound, every lab value. I flip my screen and I show them everything. It's not my data, it's yours. My job is to give it to you and explain it. At that point, though, we decide as a group, me and our patients, where I can start to recommend whether they need treatments or not and what those treatments might look like. Now, remember, anybody under 35 who's tried for a year without success and anybody over 35 with 6 months without success, I already know, no matter what their evaluations show us, that they need some help, right? So I always view my role as how do I push the gas pedal down? Because people wanted their baby last year, not when they're coming to see me now. And don't forget, if you're starting to build your family in your early to mid 30s, you have to hurry up and have the first baby so you can hurry up and have the second baby, right? These are constant conversations we have a lot. So I always view my role as pushing the gas pedal down. So we decide together whether I think they need treatments, and then we run through some of the options. Now, everybody thinks they have to go right to the high-tech IVF stuff. That's not true. There's low-level treatments, there's medium-level treatments, there's high-level treatments, there's extra high-level treatments, right? And so we fit what is best for that patient based on their data, their social situation, their age, what their goals are. So I don't want anyone to walk away from this and think that every time they walk in front of an REI, a fertility specialist, that they're going to be told to do IVF. That is absolutely not true. All right. We usually start off low and ramp up as needed, unless there's some deal breaker that takes you right to IVF. Okay. Some of those deal breakers might look like this: blocked tubes, which we test up front. Very low sperm counts, right? So mild sperm counts, we have like low-level treatments like inseminations, but severe ones, we have to go to IVF. Let's say both members of the couple are carriers for some horrible, even lethal genetic condition that doesn't affect them but could affect the baby. Well, you go right to IVF and you can test the embryo as to which ones carry it, which ones don't, and only transfer an unaffected one. Or if someone's like kind of pushing 40, like 38 and above, really all the textbooks say go right to IVF because it combats the biological clock the best. Or if they're younger, but their egg reserve is showing some weakness, that couple should very efficiently get to IVF. So those are some deal breakers, but then we take them right to IVF. Now, IVF sounds scary, especially on TikTok, right? But it's really not. There's some great benefits to IVF. So number one, super high pregnancy rates at high quality regional referral centers like us, okay? We expect you to have at least a 60% live born rate per embryo transfer. Live born rate's a baby in your arms. That's not a positive pregnancy test that doesn't turn into a baby. We're very proud of that. Top 10% of the country. You should seek out places wherever you live who only have good rates. Okay. Number two, we only put in one embryo at a time. IVF is so good these days that we don't need to put in more than one embryo. As a matter of fact, we will not put in. Good programs only put in one embryo because twinsies are adorable, but they're not safe for you or the baby, right? The other benefit is we have the ability to do chromosome testing of the embryos before we put them in. So you can screen out things like Down syndrome and other chromosomal abnormalities that lead to miscarriage. It's called PGT. Okay. And the last thing is, and this is a very important point, hopefully we get 3, 4, sometimes even 5 embryos from somebody. Well, we only transfer one at a time. So the extras then can be cryopreserved, which is a fancy word for frozen, for future tries. So you come back to me in 2 or 3 years for another baby, we just sell an embryo and pop it in. And your future pregnancy rates, miscarriage risk, and Down syndrome risk, all the things that get worse as a woman gets older, would be based on your age now when you freeze it, not your age in the future when you come back to use it. So it's really cool life hack of kind of taking the focus, the laser focus of just getting pregnant right now, to widening your view and saying, hey, what do I want my family size to ultimately look like? And do I have to be proactive now to make that work? So there's some of the conversations and concepts we get across. Very, very briefly, I'm going to talk about what IVF really looks like, not like what the scary part is. And then I'm going to turn it over to Angela. All right. So basically, if a woman, well, women know this, men don't have no clue, but if a woman ovulates 1 egg per month, which is what's supposed to happen, that does not get the job done in IVF. IVF is a numbers game, and the more eggs someone gives us, which is a function of their age, their egg reserve, and our medication protocols, the more eggs they give us, the better off they're going to be. It's as simple as that. So we give them medications, which are exact copies of the same hormones that person makes. They are not like some crazy chemical we made in our lab. They are not. They're natural hormones. They are little injections. That part is true. TikTok's right about that. These little tiny whisper thin needles that go right under your skin, 1 to 2 shots per day for an average 10 to 12 days. Some people a little faster, some people a little slower, but on average about 10 to 12 days. During that time, we monitor the follicle recruitment, how many follicles are growing, how fast they're growing, to pick the most fertile day that is unique and personalized to that individual patient. It's not generic for everybody. It's your best day. So there is some work there to do ultrasounds and blood work like every second or third day while you're on the meds. When you are ready to go, you take a different shot of medicine called the trigger shot. That's the one, I'm sure you've all seen movies and like sitcoms. That's the one that's got to be an exact time that we tell you. Okay, no joke. Don't want to be dramatic about it. Don't mess up the time. And the reason for it is that we set your egg retrieval a certain number of hours later, usually 35 to 36 hours later. That's why the timing is so critical. The egg retrieval is a short, minor surgical procedure. You do it in our office. You don't have to go to the hospital. It's super chill. It's private practice. It's classy, in and out. You're sedated through a little IV in your arm. You go night-night. Everybody loves this stuff, by the way. Full night's sleep in 20 minutes. Every single patient wakes up saying the same thing. The eggs come out of the body through the vagina. No surgery through the abdomen at all. Not even a Band-Aid on your body. Literally, it's that cool. All right? Kind of in by breakfast, home by brunch. Have your partner take care of you all day. Most people go back to work the next day. Some people feel a little bloaty and distended for a day or two. Some people need an extra day or two off of work. But for the most part, most people go back to work. So we get eggs from her. We get a sperm specimen, whether it's from a partner or frozen donor sperm or something like that. We fertilize them together in the lab and we create embryos. The embryos are going to grow for 5 to 7 days in the lab, where the strong ones make it to the end. Down at the bottom right is a picture of a final mature embryo called the blastocyst embryo, or nickname them blast. And that's the name of the game, because there's a very big drop off from eggs to fertilization to the final mature stage called the blastocyst stage over days 5, 6, 7. But that's the name of the game. You want as many eggs so I can get as many embryos, blastocyst embryos, as possible. Modern IVF, we freeze the embryos. Okay, we do not do a transfer right away. We can either do chromosome testing on them before we freeze them or not to make sure there's no Down syndrome or other chromosomal abnormalities. That's called PGT. And then the next month, you do a single frozen embryo transfer in a natural cycle with no medications of your embryo. And the transfer is not surgical. There's no anesthesia. It's like super cool. You're both watching it. You're both there. You get pictures of the embryos. It's really neat. So the hard part is recruiting the follicles, getting the eggs, making the embryos, testing them, and freezing them. The easy part is doing the transfer the next month. So that's kind of modern IVF, separating out the egg retrieval process and the embryo creation from the next month to do your frozen embryo transfer. In our hands and the hands of good quality, big IVF centers such as ourselves, you should expect at least a 60% live born rate per single embryo transferred under those circumstances. All right. I know it sounds like a lot, but honestly, it's about 2 weeks worth of work. There's sometimes some waiting 2 weeks before, 2 weeks after you can start. So one cycle is 1 month, the transfer is another month. So that's 2 months, but it's 2 weeks of work. People think that they're on hormones for months and months and months. They're not. It's super chill. So I've talked a lot just because us doctors can't clear our throats in 10 minutes, right? But I think that was a decent overview about what I go over with patients, although I spend a lot more time talking to them, like an hour. But I'd love to turn it over to Angela and Sunfish. What I would say is, for me, I've trained professionally my whole life and worked my whole life professionally to take care of these issues and help people build their family. And I can do that. My whole team is ready, willing, and able to help anybody who walks in our door. There's a big problem out there and a concern, and I bet a concern of a lot of people on this webinar, is that sometimes insurance doesn't cover it. It can be expensive, and there can be some barriers to entry there. And that's why we're partnering with this great company called Sunfish, because I see it. Some patients, they don't have the insurance coverage. It's out of their reach. It's a really big barrier. Say, look, I can handle the medical stuff. You got to handle the insurance stuff. And that's where Sunfish comes in. I'm going to turn it over to Angela.
Thank you so much. So that was a fantastic overview of the process. And having been through the process myself and helped many, many patients go through this process too, we know that this is a lot financially, logistically, emotionally. And so it's really nice to have someone by your side. We at Sunfish work with leading fertility clinics. We are very selective about which clinics we work with to design an all-inclusive bundle for people who don't have full insurance coverage to help you along the way. We help you with the costs, we help you protect your investment in this process, and we help you throughout all the steps for up to 1 year as you're going through this process. So just to introduce our team a little bit more, I mentioned I've been through 4 rounds of IVF myself. Many people on our team have been through this journey as well. And we've brought a wide array of backgrounds to help be your partner alongside your fantastic medical clinic and make this process a little easier. So we have backgrounds in consumer insurance, consumer lending, best-in-class consumer technology. I personally previously was working at a venture capital firm in Silicon Valley. I froze my eggs. I realized what a challenging process this was to go through. So have been working on helping to make the IVF and fertility process a lot easier for nearly a decade now. And we've designed an all-inclusive program. It's a bundle called the IVF Success Program in collaboration with Illume. So it's based on Illume prices and in collaboration with your doctor. So each bundle is customized to each patient. It's an all-inclusive bundle that includes your retrieval and unlimited transfers for one set price, as well as a unique refund, a cash refund, if you're not successful in your cycle. And everything can be customized for you. So I'll talk a little bit more about that. And lastly, we offer a wealth of guidance and support beyond the exam room. So your medical team is going to take great care of you as you go through those procedures, but there's so many things that come up around, for me at least, conquering anxiety around each step, how to pack for my egg retrieval, all of those questions that come up. We, Sunfish, will be your support team along the whole process.